In today's video, we look at the risk factors for Covid-19. Hi, I am Dr. Drrohanfonseca. These are the risks for Covid-19 as per a list put out by the CDC, the Center for Disease Control. To cut the chase short, all of us are at risk of Covid-19. But let us look at who is at more of a risk of developing serious illness. Let us divide the risk for severe disease into two categories. One is people with severe risks and the other will be the people with moderate risks of severe disease. Cancer. This is probably because the patient is already in a debilitated state battling his cancer. It makes him more susceptible to the disease. Patients having chronic obstructive pulmonary disease, COPD. As we know, the virus attacks the lungs and COPD is a disease of the lungs and the lungs are already compromised. Therefore, the prognosis of a patient having COPD and the Covid-19 is not very good. As we have seen of late, a lot of the mortalities are happening in people with chronic kidney disease. People who have recently had an organ transplant. When you have an organ transplant, you are given immunosuppressants so that your body does not reject the organs which have been transplanted. So the body is already in an immunocompromised position. People with serious heart conditions at a high risk of mortality from Covid-19. People with sickle cell disease. People with type 2 diabetes. So please get your diabetes under control. And if you are anywhere over the age of 30, please do get your blood sugar checked at least once. The next risk factor is obesity. Obesity is something which is very much in your hands. So this is something you can control. Please get to work on it. I will very quickly go through the list of people having increased risk for disease. People having asthma, cerebrovascular disease, that is stroke of the brain. Patients with cystic fibrosis. People with hypertension, that is high blood pressure. People with immunocompromised conditions such as HIV. People on corticosteroid drugs and other immune weakening medicines. People having neurological conditions such as dementia. People with liver disease. Pregnant women. People with pulmonary fibrosis. This is because the lungs are already damaged to begin with. Pulmonary fibrosis is basically scarring of the lungs because of previous disease. Smokers. People with thalassemia. And people with type 1 diabetes. If you notice, a lot of these risk factors are present in people who are older of age. Therefore, we ask older people to take extra care because they could be at higher risk. I'm sure most of you all are aware of these comorbidities. But let this be a refresher. Coming up next will be a refresher on the precautions to be taken during this dreaded disease. So do subscribe so that you do not miss out on that. Signing out, Dr. Drrohanfonseca.